So carpal tunnel syndrome is a condition that we treat here at Piedmont Neurosurgery. That is where the median nerve in your wrist gets pressed on by overgrowth of the ligament going through your carpal tunnel right here. Symptoms of carpal tunnel are numbness, tingling, pain, weakness, but typically it's going to be worse at night when you're trying to sleep. It might wake you up several times a night. It can be worse when you drive, worse when you're on your cell phone. You might feel like you need to shake your arm to get it awake. We can try to treat that with bracing, and that's what we do most of the time. It's not really a problem that physical therapy helps a good bit, or injection. So carpal tunnel surgery is done with an incision right here in your wrist. The surgeon would make the incision and then go in and thin out the ligament that's pressing on the nerves. It's an outpatient surgery. They usually just block your arm to do the procedure and give you medicine to make you groggy. They don't usually put you all the way under. You'll wake up in the recovery room and then shortly thereafter go home. You do have to take it easy for the first 3 or 4 weeks, not using that arm a lot. And it's going to be uncomfortable enough that it's going to remind you not to use it. Oftentimes our doctors may want you to keep the arm wrapped for the first 48 hours. When you wake up from surgery, it'll be wrapped in an ACE wrap, and you'll usually keep that on, then take it off in 48 hours. You can start washing your hands with warm soapy water. You don't want to immerse it, so no tub baths, no washing dishes, bathing children, swimming, until the incision has completely healed. You'll come back to our office in about 10 to 14 days, and we'll get the stitches out. And then you'll still take it easy, like I said, until 4 weeks after the surgery. And I would say most folks are back to doing pretty normal with their arm, 3 months or so. A lot of times you don't need physical therapy or occupational therapy afterwards, but sometimes you do. Most people can go back to work after a carpal tunnel release in somewhere between 6 to 8 weeks, depending on what you do. Now, when I had mine done, I came back to work in a week, but at that point, we weren't using our hands a whole lot. Now, if you're working on an assembly line, doing a lot of work with your hands, it might be closer to 2 months. Carpal tunnel syndrome is more common in women just because our tunnels are a little bit smaller to begin with, but it also affects people who use their hands a lot. So assembly line workers, hairstylists, even just computer work at your desk, pregnancy, being overweight, uncontrolled diabetes can make the symptoms worse.